viewers. Today I'll be talking about thyroid function tests and how often to do them while you're on replacement with thyroid hormone. So commonly when there is hypofunction or underactive thyroid, your doctor may ask you to take levothyroxine supplementation. Levothyroxine is nothing but the prohormone of the active hormone T3, which is available widely in a chemical form, and your doctor will ask you to take this as a daily supplement, early morning, empty stomach with water. So typically, how often do we need to check the thyroid function? So the most common setting where we request a frequent checking of thyroid function is during pregnancy or when you're planning for pregnancy. So if you're undergoing IVF treatment, or if you're pregnant, typically we would perform the thyroid function test every month, because in these situations we cannot have a sudden increase in TSH or a hypothyroid state actually. So because this increases the risk of miscarriage and preterm labor in these situations. So typically we go for a monthly thyroid function testing during pregnancy, at least in the early part of pregnancy. In the later part of pregnancy, we can do every 2 months as well. Outside of pregnancy, another condition where we do frequent testing of thyroid function is in congenital hypothyroidism. When a child is born with hypothyroidism due to agenesis of the thyroid gland or due to an abnormal hormone production in the thyroid gland, so the TSH will be high at birth. So these children require thyroid replacement as soon as they are born. So in this situation, typically we will do a thyroid function test every month until the thyroid function is stable, because this period of life is also very important in terms of brain development, which will have impact well into adulthood. So this period again requires a close follow-up and performance of thyroid function test. Outside of these two situations, there are rarely any requirement to do the thyroid function test more often than once in 3 months. So 3 to 6 months is the ideal duration over which we perform thyroid function tests in other situations. And typically, once you've been on a stable thyroid regime, that is, your thyroid hormone dose has not changed for several years, then your doctor may ask you to perform the thyroid function test once a year along with your annual health check. So this can be this will increase the ease of your intake. But one thing you should remember is never to stop your thyroid supplement just because your thyroid function test has not been done. So for example, if your thyroid function test has not been performed for 6 months, whereas it is due in 3 months, do not stop your thyroid supplement and then do the thyroid function test. So ideally, while doing the thyroid function test, you should be taking the prescribed dose of thyroid hormone. The purpose of the thyroid function test is to determine what dose you need to be given. So if you stop the tablet, then the doctor cannot determine what is the dose that is required for you in the till the next visit, and they may ask you to come back again while taking the stable dose of thyroid hormone. So this is something you need to remember.